So thank you everyone for your patience. And again, we will restart this today topic, that is Lassa drug, look alike and sound alike drug. So why I have choose this particular topic? Because we have facing lot of problem in our hospital, during our working days, during our day-to-day activities. Like example, I have choose like betadine. Patient has uh, throat infection, doctor has written betadine. Even patients came to our pharmacy and he has given this particular prescription to our pharmacist. Instead of betadine gargle, our pharmacist has given betadine solution or betadine scrub. In betadine gargle, it's contain 1% powered in iodine, but in betadine solution, it contain 5% powered in iodine, 7.5% powered in iodine scrub. But instead of written gargle, our respective doctor has written only betadine, and this errors occurs in the prescription. Even though, even though the patients, uh, one renowned example I will share with all of you. Uh, I will not disclose the name of the hospital, but one mm, patient was admitted in hospital, and a that was the neonate. And doctor written piperacillin tazobactam to the neonate kids only 0.45 milligram or gram. Instead of 0.45, our pharmacist has given 4.5 gram piperacillin tazobactam to the nursing department. The nursing department, the concerned nurse has inject 4.5 grams to the neonate, and within 3 days, the incidence was occur, and immediately neonate was admitted again in emergency. So, my dear friends, the existing of confusing drug name is one of the most common cause of medication error. And this is not in India, it's a worldwide concern. And because some brand name and generic names sound and appear to similar to the other drug whenever they are written or spoken. So these confusing drug names is one of the main cause of medication error. And if you have seen my slides, I have shown you two drugs. That is, one is thyroxine, other is lanoxin. Both are looking similar. So if they are similar looking, but their mode of action are differ, like thyroxine mainly used for thyroid patient, and lanoxin that was used to treat cardiac problems. Instead of thyroxine, patient took the lanoxin. That errors occur, and that may cause harmful even death to the patients. So according to the United States of Pharmacopoeia, and approximately 1400 commonly used medication error. If this occur, we have their one ISMP. They have regulate this agency, that is Institute of for Safe Medication Practice. So they have prepared the confusing drug name, and that name are published in Institute of Safe Medical Practice. So I have took few examples. That is MZIT, NZIT. Suppose I have just pronounced MZIT, NZIT. Sometimes it shows the confusing. MZIT is metronidazole and NZIT is alprazolam. Elspan and Elspan. One is loratadine, other is hyoscine butyl. Levozin and levozin. One is levocitrazine, other is levozin iron. So even though I have seen one prescription that a pregnant woman doctor has written levozin tablet. That is iron tablet is required to pregnant women. Instead of levozin, that is iron tablet, concerned pharmacist has dispensed levozin, levocitrazine, and 1 month patient took that levocitrazine. Even after few days, MTP has be conducted because that effect on the fetus. Intexin, intexin. One is ofloxacin, other is cefixime. Tozar. One is losartan, another is piperacillin tazobactam. You can see how the prescription, how the confusing name cause the error, even the death of the patient. So, what are the different source of error? And the main reason for improper dispensing of confusing brand name due to ignorance, due to lack of knowledge, due to less number of pharmacists during rush time. So if this will be happen, mainly the result from one to following situation. One is illegible handwriting of the prescribed physicians. Sometimes there is the pharmacist is confused. He is not recognized the prescription. Incorrect dispensing by the pharmacist. If pharmacist has night duty, even after that he has again morning duty, and similar looking name, he's confused. Incorrect reading of brand name by the patients while ordering the medicines by phone. And this was happened during our corona seasons, because in corona seasons patients require the medication, patients call, demand the medicine on phone, in phone. So sometime again prescription error occur, and the death will be occurs due to this particular error. So as a pharmacist who will work, they must be ensured whenever he or she dispense the drug, he must ensure the spelling of the drug. Even though pharmacist has, if any confusion, he must be contact with doctors. Doctor, you have written this product or not? So this is the error. Now again, error prone drug pairs. So there are a number of pairs. One is drug, similar brand name, different generic composition. Similar brand name, same generic composition. Similar brand name with additional letters. Similar brand name of the antibiotic group. Same drug, different doses form. Same drug, different release of characters. Same brand, different composition in different companies, countries, and generic drug pair. So I have one by one discuss about these particular error-prone drug pairs, like similar brand name, different generic composition. Almox. One is albendazole, another is amoxicillin. By the mistake, amoxicillin that is given uh, 5 days first BD to the patient, and albendazole is deworming tablet. By the mistake, patient took albendazole BD for 5 days, his gastric flora burst. Azome. One is esomeprazole, other is azithromycin. Levozen. Already I have discussed about the pregnant women's case, how the drug prone errors occurs. Pios and PAS. One is pioglitazone, antidiabetic drug. PAS is alprazolam. Again, if the patient took instead of alprazolam, he took the pioglitazone PAS. His hypoglycemia will be occur because it's used in hyperglycemia. Tazar. One is losartan, another is piperacillin tazobactam. So another class that is similar brand name, same generic compositions. As active aclov, one is acyclovir. How this error war occurs? Sometimes one patient is not satisfied from one doctor. He visit to another doctor, and doctor just change the brand name, but generic name was similar, and dose sometimes they have taken maximum dose and error occur. Alertins, both are cetirizine. Amdipine, amlodipines. So this type of occur when patient visit to different pharmacies or different doctors with same particular disease. Similar brand name with additional letter, like Almox, that is amoxicillin. Almoxi, that is amoxicillin with cloxacin. Taxim and Taximo. Taxim is cefotaxime and Taximo is cefaxime. So mainly cefotaxime is gram-positive, gram-negative bacteria, UTI infection, and cefaxime is bronchitis, for treatment of bronchitis problem. tried amitriptyline, tried P amitriptyline chlorodiazep oxides, and tried PF, that is 10 mg chlorodiazoxide is more. So you have seen the prescription, the slides where Taximo, Taxim OF, and Taxim 1 gram name is similar, but the composition is different. Similar brand name with antibiotic group. Ordox, Arflox. One is doxycycline, other is ofloxacin. My dear friend, like doxycycline always prescribed during skin problem, and ofloxacin, that is in UTI or pneumonia. Another similar brand name, Megadox, Maclox, Megaflox, even though you can't explain what I have told. Megadox, Megaflox, Megalox. One is cloxacin, other is doxycycline, other is ofloxacin. Microdox, Microflox. One is doxycycline, other is ciprofloxacin. Means how error occur, brand name is similar, even though in antibiotic group. Similar drug, different doses. Cefdrox dry syrup, that is cefadroxil. Cefdrox 500, it means cefadroxil 500 capsule. That is, I have again discussed similar like betadine. If there is not mentioned is cefadrox tablet, cefadrox 500, it means it's contain capsule. Cefadrox P means it's a pediatric dose. Cefadrox DT means dispersible tablet. What cefadrox is given? Who is the patient who took these medicines? That is the important. So that's why whenever we see the prescription, we look after the particular prescription, we recheck the prescription, what has mentioned. Same drug, different release of characteristic, like Arflox, Arflox DT. One is dispersible tablet, other is normal. Voveron and Voveron SR. One is diclofenac, other is sustained release tablet. Immediately, some patient have immediately relief. We must be given sustained release tablet. Similar brand name, different composition in different country. It's a very interesting, very interesting. Kit Kat, my dear friends, Kit Kat. Like Kit Kat, in Nepal, it's a brand name, generic name is albendazole. In our India, Kit Kat is a chocolate. Any doctor who visit India and he has, we have given some drugs like albendazole drug to the patient, and doctor has prescribed Kit Kat to the patient. No doubt patient will be happy. Doctor has written a chocolate, but it's contained albendazole. Same Milol and Milol. One is atenolol amlodipine. That is in India, and in Nepal, it's a metoprolol. Megadox, one is doxycycline, another is acyclophenate. Amrel, glimepiride, Amrel, atenolol in Japan. Both are, one is antidiabetic, another is antihypertensive drug. So nowadays we say you must be right a generic prescription. Again, Lassa occur during our generic prescriptions. Acetohexamide, acetazolamide, folic acid, folic acids, amantadine, loratadine, alprazolam, lorazepam, clonazepam. Both, even though they are the anti-sedative drug, but again, it's an error. Lantus lente, cetirizine, sterolin, nifedipine, nimodipine. So what I'm trying to say, if these drugs are given some like sterolin, that is given in OCD, obsessive compulsive disorders, cetirizine, anti-allergic. So that's why error occur. And as a pharmacist, as a medical practitioners, as a medical field people, we must be recheck the drug, how to dispense the drug, how to write the prescription, and what are the main error occurs. So if there is error, what will be happen? One is error producing conditions, which likelihoodly error occurring, environmental process, drug involved, patient characteristic, nature and type of error. So any all characteristics of drug product can increase or decrease risk. So it must be considered in risk assessment. One, we should know generic name, brand name, dose, which type of dose given, what is the strength of the dose, which doses form, it's a tablet, capsules, injectables, oral, what is packing, what are the route, frequency, storage requirement. It's a cold chain requirement, it's a normal temperature requirement, indication, which type of indication this drug is given, and patient populations, environment. So how? Now, predictable problems. Doctor has written hum insulin, nurse row hum log was to be given. You have seen during my presentation which insulin is mentioned. What happened? 60 regular insulin now, but basically it's a 6-unit regular insulin. If a patient is again diabetic and 60 unit immediately given to the patient instead of 6 unit, hypoglycemia occur, immediately patient should be admitted in emergency. This problem was occur, and same, one midazole, one is pantoprazole, another is midazolam. And this was occur in a hospital where in OT anesthesia department, they require midazole. They request to the pharmacist, just provide the midazole. But instead of midzole, our pharmacist has given pantoprazole because doctor demand the brand name. Immediately, doctor came to the pharmacist, we require midazolam, medzole, but you have given pantoprazole. So that is the confusing, and that prescriptions that as a medical practitioner, as a pharmacist, we have seen this type of problems. Eligibility and drug name. We can't understand. It's a unicin on vancomycin. So unicin mostly pro upper respiratory tract infections. We have given vancomycin, inflammation of the intestine. Next, Proteanex or protamine. Protamine improve the anticoagulant effect due to heparin. Proteanex is a antioxidant. Capoten or Cozar, one treat hypertension, other treats again hypertensions. So what is the solution? If this error occur, is there any solution? Yes. One is we should identify the LASA medications. We create the environments. We have making a list of drugs that having look like or sound like. Prescriber role. Prescriber must be written in uppercase handwriting. His full name of the drugs. Maybe in generic name, dosage form, strength, all should be written. And directions also. Now, what are the pharmacist role? So pharmacist providing the dose, other details in the prescription, that should be, he use his knowledge. But in certain case, he must be discussed with senior pharmacist. And if he has any confused about the particular drug, he must be rang out. Sir, you have written this drug or not? I have received your prescription. Even though nowadays it's a very easy, the prescriptions are most probably online, right? Patient is in doctor cabin, and similarly, the doctor has written the prescription in the laptop, and prescription goes to the pharmacist. And whenever the patient came to pharmacy, his drugs was dispensed. So there is a less error whenever this is online prescriptions. Now, what is the patient role? Again, I have all discussed during Corona time, patients demand the medicine on telephonically. So patient, it's a new era. He or she must be use the mobile phone and just click a pic and send the pic to our respective pharmacist for dispensing particular drug. Now, hospital or institutional role. In hospital or institutional, they must be use, educate educate the concerned pharmacists, students about what are the LASA drug, what are the error occur, and they have making a list of the particular drug, and that list must be given to the prescribers. So prescriber can easily check. Even that can list also showing to the nursing department, also educate the pharmacist. These are the LASA. Whenever you prescribe the drug, you must be recheck the prescription. Now, manufacturers or regulatory agencies role. So manufacturers and regulatory agencies both should work together hand in hand to avoid confusion right at the time of naming the product. Like I told you, Medzol and Medzol. Both are regular. One is Midazolam, another was the something, esmoprazoles. So nowadays, one Tolman wording are used. That is, this is a typographic technique. Here, similar look medicines name easier to differentiate. How? That is the example. Like beta lock and beta null. Beta is similar, that is in small, lock and null in capital. Co-dopa, car-dopa. Dopa is similar, co and car in bigger letters. Imigra, adigra, Sidona, Cedrona, Dubotamine, dopamine. Amine is similar. Other words must be used in capital letters. So this is the examples. Acetazolamide. Aceta in small, zolamide in capital letters. So how it's work? It's work to differentiate how look alike sound like medications name. Like fluoxetine, fluvoxamine. Flu and flu, they are smaller. Tin, INE, that is smaller, and oxygen and voxum, they are in capital letters. So it means eyes can easily distinguish between these two products if they have similar look alike. Now, what is the patient safety solution? As a pharmacist, as a nursing department, as a medical practitioner, always keep LASA drugs separate from one another. Double checking of the drug is required for LASA. Contact the physician in case of clarification regarding the prescription. If you have any clarification, must be discussed. Become familiar with LASA. Educate your students, educate your pharmacists, educate your paramedical staff about this drug. Minimize the use of verbal or telephonically order. Again, I told you, whenever you received any prescription by telephonically, as a pharmacist must be again called, sir, you require this medicine, or please just send me the prescription on my WhatsApp group, or repeat the spell. So on the last, again, we should circulate the list of confusing brand name and encourage to reporting the error. We will encourage our junior pharmacists, our students, for if there you having got any type of LASA, just a report and improve the medical error reporting. So this help to avoid any ADRs, any side effect due to LASA drugs. So in DMC hospital, they have sound like and look like, they have already mentioned, you can easily see. They have narcotic drug, again segments. And if you will do excellent work, you will reward it. So different rewards, even though me and my students have got during the work in different segments. Even this LASA presentations discussed in different countries, that is awarded by different hospitals also. And I thanks to my guide, PhD guide, Professor Sandeep Kaushal. He always motivated to me to do the work in these segments. So this lecture is also available on YouTube. You can also check on the particular segment on YouTube also. And nowadays we are very busy. We are busy on Facebook. We are busy on WhatsApp. We are busy in Instagram. If this type of occur, no doubt anti-WhatsApp tablet will be launched very soon. Even de-addiction centers, one patient came to the hospital, another patient relative told all night alcohol, another say no, it's all night WhatsApp. So take care of your health so that we can also save the other lives. Thank you to all for your patience and listening. So if you have any question, you can just write in chat box. I will solve the queries. So thank you, everyone, because with a short notice, you join this online segment. I also thanks to the CRC department who invite me for this particular segment. Even though I also thanks to my research scholar, my colleagues, my co-host. Thank you. And even though I have just checked, Dr. Manisha from MMU, Milan Zina from International Public Personality, Deepthi Gupta, and my colleagues Basir, Aman, Dr. Priya, Nikita, Jasprit, Moni. Thank you to all. Thank you, Harvinderji, for joining. Harvinderji is the Vice Chairman of Indian Pharmacists Association, and he organized my lectures time to time.